Hello, everyone, and welcome back to the Medical News Update. Today, we're discussing a recent study on the association between cannabis use and cardiovascular outcomes in United States adults. A study published in 2024 in the Journal of the American Heart Association investigates the relationship between cannabis use and cardiovascular health. The research highlights increased risks for heart disease, heart attacks, and strokes among cannabis users. The study found that regular cannabis use is associated with higher odds of experiencing cardiovascular events, with the risk increasing alongside the frequency of cannabis use. This population based cross sectional study analyzed data from 434,104 respondents aged 18 to 74 years collected through the Behavioral Risk Factor Surveillance Survey from 27 American states and 2 territories between 2016 and 2020. The study focused on the number of days cannabis was used in the past 30 days and self reported cardiovascular outcomes, including coronary heart disease, myocardial infarction or heart attack, and stroke. Let's look into the findings of this study. First, let's talk about the prevalence of cannabis use. According to the study, 4% of respondents reported using cannabis daily, while 7.1% used it on a non daily basis. But what about the associated risks? What did this study find regarding the cardiovascular outcomes for these cannabis users? The study found some concerning associations. Daily cannabis users had significantly higher odds of experiencing adverse cardiovascular events. Specifically, they had a 25% higher risk of having a myocardial infarction or heart attack. Their risk of stroke was 42% higher compared to non users. When looking at a composite measure of cardiovascular outcomes, which includes coronary heart disease, myocardial infarction, and stroke, the risk was 28% higher for daily cannabis users. The study also looked at people who have never smoked tobacco. Among never tobacco smokers, the risks were even more pronounced. The odds of having a myocardial infarction were 49% higher. The risk of stroke was an alarming 116% higher. For the composite cardiovascular outcomes, the odds were 77% higher. Those numbers are really eye-opening. It seems that cannabis use alone, even without the confounding factor of tobacco use, is associated with a marked increase in cardiovascular risks. As an observational study, it cannot establish causality. Self-reported data may also introduce recall bias. Additionally, the study did not account for all potential confounders like baseline lipid profiles or blood pressure. Given the increasing prevalence of cannabis use and declining perception of its risks, these findings underscore the need for increased awareness about its potential impact on cardiovascular health. Health professionals should consider screening for cannabis use and advising patients on the associated cardiovascular risks. Thank you for joining today's episode of the Medical News Update. For more insights into the latest health research, make sure to subscribe to our channel. Until next time, goodbye.